All right. Well, it is almost 1:30, so I'm going to go ahead and open our meeting. So I want to say thank you to everybody for coming today. We have a great crowd, so I'm really excited about that. Val Guzman is here. He is from the Area Agency on Aging. He's going to be able to give you all sorts of great information. I've heard from somebody else who actually gave you a call and talked to you recently on the phone and had nothing but great things to say about you. So he's got a lot of wonderful knowledge that he's going to share with us today on Medicare as we move forward and what's going on and what's new in 2022. So with that, I'll let you take over.
Oh, thank you. And thanks for having me. Thanks for inviting me. So like again, my name is Val Guzman and I work for an agency. It's called Age Guide, but we're also considered the Northeastern Area Agency on Aging. So basically that means that we're a regional based organization that covers 8 different counties around just outside of Cook County, and one of those is Will County. And we do a variety of things. So we primarily receive funding from the state and federal government to provide various services like transportation services, meal programs, caregiver assistance programs. But for today, one of those is through the Senior Health Insurance Program. So this is where we have counselors like myself where we can help you navigate Medicare and other health insurance options just to make sure that you are getting the plans that cover you the best or that do save you the most money. So that's why I'm here to give you as much information as possible, and especially just to report on some of those changes that you can expect for 2022. So as you may already know, so the Medicare open enrollment period is every year starting October 15th to December 7th. And any changes you make during this open enrollment period, they would take effect next year or January 1st. So the types of changes you can make are you can enroll in or change your Part D plan. That's what covers your prescriptions. Or if you were interested in one of those Medicare Advantage plans, you could either join a plan or you can switch out of it. Say if you've tried it for 1 year, but you want to switch back to original Medicare, you can do all of those things during this open enrollment period. And also, if you happen to already be enrolled in one of those Advantage plans, they actually give you another open enrollment period starting January 1st, and that goes until March 31st. So that's only if you currently are with one of those Medicare Advantage plans. So you just know that you do have even more time to make changes to your coverage. And also, if there is someone or anyone that isn't already enrolled in Medicare, just keep in mind that while this open enrollment period can apply to you, you also get a total of 7 months to enroll in Medicare or to make changes or sign up for plans. So in case any of you don't have Medicare yet, just know that once you get to age 65, they'll give you 3 months before the month of your birthday. They'll give you the month of your birthday, and then plus another 3 months after to make any arrangements with the types of plans that you want. And so for the drug plans that are offered in Illinois for 2022, there actually was a drop in the number of plans that are offered. One of the reasons for that is that Medicare is dictating or essentially only allowing insurance companies to offer a total of 3 plans. That is a change from last year where they were all able to offer more. But the premiums can range anywhere from as low as $6.90, and the highest I've seen is about $94.30. And the deductible did go up. I believe for 2021 it was about $445, but for next year it is actually up to $480. There are some plans that don't have a deductible or have a lower, but most of them this is the most that they can charge for a deductible. And even though some of those plans may have deductibles, that doesn't necessarily mean that you'll pay the full price for your medications until you get to that deductible. Because, for example, some generics, they will charge you the discounted rates right away or right off the bat. So just keep that in mind too if you are comparing the plans. Just because it has a deductible, it doesn't necessarily mean that, that your medication costs will be higher right away in the beginning of the year. And then also definitely keep an eye out for, it's called the annual notice of change. So this is a letter that you should have received if you have a standalone drug plan. You should have received it somewhere towards the end of September or early October, where they usually explain if there will be any changes to your plan for next year or if there are price changes. If you didn't get any notice of change, you might just need to request it from your plan provider. Or you have another option that I'll explain later about how you can just go ahead and look at the plans for next year. Did you have a question?
Yeah, the $480, is that monthly or annual?
So the deductible, that would be annually, right? So once you meet that, then you'll be set for the rest of the year. But yeah, it's only once. And feel free to jump in if you have questions, especially if it's something about the slides. Yeah, just feel free to jump in. That way we can address it right away. Yes?
You're in a plan now, supplementing drugs. Does it automatically renew if you don't do anything in 22?
Yes. So normally, if you're happy with your plan or if there aren't any major changes for next year, you can just leave it be and they'll automatically enroll you in the plan if it's offered for next year. But I would say keep an eye on that because I'll go over it also, but especially if it was one of those plans that was canceled or not being offered for 2022, they may enroll you in a plan that you may not necessarily like, or it may not actually work as well for you. So yes, they do automatically sign you up, but it's always good to go back and just to make sure it is the plan that works best for you. Okay. And so like it says at the bottom, these plan premiums and drug prices, they can change year from year. So that's why it's good to go back just to make sure that you are having the plan that works best for you, because it can change year to year, and sometimes I've seen drastic changes where if you for some people, if they stuck with the same plan, usually it can be in the hundreds of dollars that you can save if you do switch to a different plan. So even though, like I said, even if you have a good relationship or you've had a good experience with a certain insurance company, it may not always work out that they're still offering you the best plan. So just for example, if you are with a plan with WellCare, they actually had 4 total plans that were no longer will be offered in 2022. And actually one in particular, I noticed a big change where in 2021, the monthly premium was $20 a month. But for those people, you're being automatically signed up for a plan that's actually $68 a month. So that plan may still work for you, but just keep in mind that sometimes there could be some drastic changes in your monthly premium because they made these changes where certain plans aren't being offered for next year. Another company is Express Scripts. So if you do have a plan with Express Scripts, you might want to just make sure that it isn't one of those plans that was canceled for 2022. And there was also one plan through Blue Cross Blue Shield that was also canceled.
Is that Blue Cross and Blue Shield, it's not the Medicare part, is it, or it's just the drug part?
Just the drug part, right. So if you have a Blue Cross Advantage plan, that wouldn't apply here. This is only for the standalone prescription plans. Okay. And that's why definitely if you have that annual notice of change, that's where you would be, they would detail if there are changes or if the plan from last year is being canceled. So definitely, if you haven't already, you might just want to double check that just to make sure. And this isn't necessarily a change, but I did want to go over this because especially if you have higher medication costs, there is something called the coverage gap. You may also know this as the donut hole. And while the donut hole technically closed in 2020, this is essentially the same thing, and this is essentially what replaced that. So just so you have an idea of how this works is that with your Part D prescription plans, there are different benefit periods. So essentially it starts with your drug deductible. So if you do have a deductible, that would be your first benefit period. And then you're in the initial benefit or initial coverage period. And then finally, you would be in the coverage gap, so that would also be the donut hole. And then depending on how much you spend for your prescriptions throughout the year, then there would be also a catastrophic phase with your Part D plan. So just so you have an idea of the numbers for this coverage gap, the coverage gap begins once you've spent a total of $4,430 in your prescription costs. So this includes what you pay for your medications, but also what the drug plan pays. So what you might see when you fall into the coverage gap is that some of your medication costs might go up for some time until you get out of the coverage gap. And when you come out of the coverage gap, that's usually when your total out-of-pocket costs reach this $7,000 figure. So especially towards the middle of the year, that's where you might see your prices go up, and then towards the end of the year, you might see them go down. And this is usually when you have higher prescription costs, or if you do reach these figures of the $4,000 and the $7,000. The way you can find out whether you do fall into this coverage gap is if you go to the Medicare website, and there is something called the Plan Finder on the website where you can shop for or compare the various prescription plans or even the Medicare Advantage plans. And one of the pieces of information that it would tell you is whether you will fall into the coverage gap and also whether you would come out of it. So that's why I say, especially if you have expensive medications, if you did want to look into that, that's where you can get in touch with a SHIP counselor like myself, or there are local offices nearby that where we can help you find out if that would apply to you. So like I was saying about that Medicare Plan Finder, so this is directly on the Medicare website. So because of that, they will show you all of the plans that are available in your area. It's an unbiased resource, so that way you're just giving as much information as possible, and you're given every plan that's available to you. Because it could be that if you go directly to an insurance company's website, or if you call them directly, they may highlight their plans first, as opposed to the ones that may cost you less. So that's why if you go directly to the Medicare website, you're more likely to see an unbiased resource of what plans are available to you. And like I was saying, so it will show you the monthly premium, it'll show you the cost of your medications, it'll show you the deductible. If you say we're comparing those Medicare Advantage plans, it'll give you the copays, you can even select the pharmacy that you go to just to make sure that your pharmacy is an in-network pharmacy with the plan that you're looking to go with. So it has a ton of information that can really help you budget for the following year, or just to make sure you are getting the plan that costs the least. And then also another nice thing is directly on the Plan Finder, you can go ahead and sign up for the plan that you find. So that way you don't necessarily have to call the insurance company. I know they keep you on hold a lot. So this is just another way that you can just go ahead and sign up or change your current plan. So if you did want to give or try out the Medicare Plan Finder, you would just go to the Medicare website. It's medicare.gov, and usually right front and center you'll find a button that says Find Plans for the next year, or in this case 2022. So you could either create an account on the Medicare website, or you can also just bypass that step and you can still do all of the same steps without creating an account. But there are some benefits to creating an account on the website, because you can, for future years, it'll save all of your information, like your contact information. It'll even save your medication lists. It even gets updated from Medicare if you do have changes into your medications, or if you start taking something new. That'll all automatically show up if you create an account. Because usually if you get help from someone like a SHIP counselor, normally you would have to provide a list of your medication every year, and if you have a longer list, sometimes it can take a little bit longer. We don't mind taking that list from you, but just know you could save a little time if you create an account. And I talked about the pharmacies. So some of the costs for next year, so I wasn't able to find an absolute or a final number, but it is expected that your Medicare Part B premium would go up a little bit. I did see that it might go up about $10, so it's currently at $148. So just know you might see that increase next year. They haven't told us when it would take effect, but that's just something to keep an eye out for. They also plan on increasing the Part B deductible. That one is currently at about $203. I didn't see an estimate of what it could go up, but it shouldn't be too much, but just know that that also might go up for next year. And just so you know, for Part A, there aren't any changes to that. For most of you, it's Part A is free. There isn't a monthly premium for that. There could be a premium for Part A depending on your work history. So essentially, if you worked less than 10 years, then you might have a Part A premium. But otherwise, for the most part, most of you shouldn't have a monthly payment for Part A. And so for Medicare and COVID-19, so the COVID vaccines are still free, even for the boosters that they're now making available. So if for some reason someone is trying to charge you for a vaccine, that shouldn't be the case. Those are free. Those are being billed directly to Medicare. I know sometimes the pharmacies or where you go for the vaccine, they might ask for your Medicare card, but they're billing Medicare. You shouldn't see a bill for any of those vaccine shots. And also, Medicare does cover COVID-19 diagnostic tests, the antibody test, and the monoclonal antibody treatments. And so those are covered by Medicare. And then I did also want to talk about Medicare and Medicaid. So if you're not familiar with Medicaid, Medicaid is it's more of a state-based health insurance program where to be eligible, you do have to meet income and asset limits to qualify, but you can have both. So you can have Medicare and Medicaid, where Medicare would be your primary insurance, and then usually whatever Medicare doesn't cover, Medicaid would pick up the rest. And even if your income is higher, I wouldn't completely discount qualifying for Medicaid, because there are ways to still qualify for Medicaid, especially if you have higher medical costs. So anything from doctor's visits, or if you do have an expensive hospital visit or higher prescription costs, it still could be that you qualify for Medicaid, and that could save you on some of those, some of the more expensive medical bills that you might receive. And there are benefits that can help you save on your Medicare costs, because I know you're getting just bombarded with commercials and mailings about how you can save with Medicare, or I know I've seen one commercial where they're promising Social Security would return money to you. I'm not exactly sure how they would do that, or if because there isn't really that I know of a way for you to be returned money, or just a lot of those benefits are usually through one of those Advantage plans, because usually those can offer additional benefits, and I'll explain a little bit more about those. But just be very careful when you are being promised free services, or if you are being promised money back. Just be very skeptical about those, because the main ways that you can save on your Medicare costs is through something called a Medicare Savings Program. This is also income-based, and they look at your assets also. But if you qualify, this would actually pay for that Part B premium, that $148 that they normally take out every month. And then depending on how, where your income is, it might also pay for Medicare deductibles or Medicare co-payments or co-insurance. So if you weren't already aware, if you do have maybe lower income, or if you just want to check if you might still qualify, definitely check in with us, and we can explain more in depth what those eligibility requirements are, and then we could even help you apply also. And the other main benefit that can help you with your costs is through a program called Extra Help. And what this program does, it helps or gives you a discount on your medications. So this could allow you to enroll in a Part D plan or your prescription plan that actually has a $0 monthly premium. And then it'll also discount your medications. So either most of your medications would either be $0 or the most that they could charge you is somewhere where about $3 for generics or about $9 for brand name drugs. And this is one of those benefits where even if your income is higher, there are other ways or almost backdoor ways where you can still qualify, especially if you have a higher medical costs. So just keep that in mind. If your medication costs start to go up, or if you do have maybe a larger medical bill, you may be able to have or qualify for this extra health benefit. So just for example, there are a total of 7 plans that would actually have a 0 monthly premium if you do qualify for this benefit. You can also apply through that program through us or through SHIP counselors. And like it says, most recipients of this benefit have almost 0 cost for your medications. And so if you do have Medicaid, so I did want to explain a little bit about the Medicaid program. If you're already enrolled in Medicaid, or if you did qualify at any point in March of 2020 until now, your coverage with Medicaid will continue until the pandemic is considered over, or until the federal government considers the national emergency declaration to be over. So just know, even if you qualify now, that coverage will continue almost indefinitely until they make that announcement. Because normally with Medicaid, you do have to renew, or they call it a redetermination every year. But for now, if you're with Medicaid, you haven't received those because they essentially don't want anyone to go without health insurance, so they're not interrupting anyone's coverage. If for some reason you are knocked out of Medicaid, either recently or going forward, that is an error. They should not do that while the pandemic is still going on. So if that does happen, you should contact Medicaid right away, or just you can also get in touch with us at Age Guide or one of the other SHIP sites, and we can help you get back onto Medicaid or just have it reinstated. And then if you do qualify for Medicaid, this is also something that's new. When you have both Medicare and Medicaid, there's also a program called MMAI. That stands for Medicare, Medicaid, and Alignment Initiative. So what this is, or what this program does, is it wraps or bundles all of your Medicare and Medicaid services into one plan. And what the state is doing, or what they started doing over the summer, is that if you do have both of those programs, or if you have both Medicare and Medicaid, you're being automatically enrolled into one of these plans. They are notifying you ahead of time, but if you didn't receive this notice in the mail, or if you just ignored it, your coverage could change pretty drastically because you are being enrolled into one of these plans. And they can have pretty strict networks, or your current doctors may not necessarily accept these plans. So keep an eye out for those, especially if you do have both Medicare and Medicaid, because you do have the option to opt out of these. So if you'd rather switch or stay with your current coverage, you would have to make a phone call into the state of Illinois, and then they would make sure that you don't get enrolled into this plan. But it would take that extra step that you do have to call just to make sure that you're not being enrolled in this plan. That doesn't apply to everyone. For some people who do receive certain state benefits, or they call them waiver programs, you may not have the option to opt out of these programs. So just know, if you do have any service, like if you have caregivers that help you at home that the state provides, or if you go to an adult day service, that's one of the other waiver programs. In your case, it gets a little bit more complicated. It is possible to opt out, but there are some special circumstances. So for that, definitely, if that applies to you, definitely get in touch with a SHIP counselor, or call the number on the letter that the state sends you, just to make sure that you know what your options are. And then also, I wanted to give you a little bit more information about those Advantage plans, because I know that's another thing that you're just getting a lot of advertising or information about. So essentially, there are 2 different ways that you can get your Medicare coverage. One of those is just with original Medicare, regular Medicare. So that means you would have your Part A, your Part B, your prescription plan, and then sometimes people have supplement plans. And then the other way is through these Advantage plans. So these are managed care plans where your Medicare services get wrapped up into one plan. So that usually includes your Part A, the Part B, and usually it does include your prescription coverage all into one plan. And then they also are able to offer extra services. So that's where some of those commercial mailings, they will advertise that they can offer things like dental, vision, hearing coverage. Some of them even offer transportation services or gym memberships, things like that. Those are real, but you would have to sign up for one of these separate plans. I know it's been in the news where they're trying to add dental benefits or vision benefits to regular Medicare. Nothing has happened on that yet. I believe they're still trying to pass that, but it hasn't been finalized, or they haven't said if that will actually happen. And the other thing to keep in mind with these Advantage plans is that they also work with networks, so they can be more restrictive about where you can go for your medical treatment, or if you go to certain providers. So definitely keep that in mind. If you are interested in one of those Advantage plans, I would really recommend to check with your doctors, your primary doctor, any specialist you might see, any other offices like nursing facilities or home health agencies, just to make sure that if you do want to sign up with one of those plans, that they actually accept it. Because otherwise you could actually have out-of-network costs, and that would just lead to higher expenses. And so even if you choose an Advantage plan, it does have to include all of the normal services that Medicare covers, so hospital visits, your doctor's visits. That is all still covered. It's just that they are able to offer those additional benefits. And then one thing that is unique to these Advantage plans that isn't available with Original Medicare is that they are able to offer an out-of-pocket maximum. So essentially, once you reach this maximum, the plan will pay 100% of the cost for any of the services under Part A and Part B. So some of those I've seen that could be as low as it's about $2,600. A lot of them are in the $3,000 range. So once you reach that number, then the plan would cover 100% of the costs. Because normally with just regular Medicare, there is no limit of how much you would have to pay unless you had something like a supplement plan. But then just keep an eye out, just be careful, because some of those limits can be higher, or especially if if a doctor you need to go to is out of network, they actually have different out-of-pocket maximums for in-network doctors and for out-of-network doctors. So just be very careful when you're looking at those limits. Oh, and then right at the bottom, so most of those Advantage plans do offer drug coverage, but there are some that actually don't offer additional prescription coverage. So be very careful with those, because if you do select a Medicare Advantage plan that doesn't cover your medications, for most of those you won't be allowed to purchase a separate drug plan. There's only a very specific type of Advantage plan where they will allow you to purchase a separate drug plan. So that's another, just make sure that when you're comparing those plans that it does actually cover your medications. And then, so like I was saying, so if you do go with the route of having your Medicare services covered by Original Medicare, one of the options you can have to supplement your coverage is through these, they call them Medigap or supplement plans. And these are offered from private insurance companies, so companies like Blue Cross or United Healthcare. There's a long list of these. But these plans, they are regulated by Medicare, where no matter which type of plan you choose, so they split them by letters, and they don't make it very easy since Medicare already has plans organized by letters, but no matter which supplement you choose, whether it's with Blue Cross or with another company, if it's a Plan F, that does have to be the same with any of those insurance providers. They can be different in price, so that's where it can be pretty drastic. Sometimes one company might charge a lot more than another's, so it's always good to compare those just to make sure you are selecting the one that works best and that does cost the least for you. And then If you're already with the supplement, if you were interested in changing, just be very careful because normally you only are allowed, they call it a guaranteed issue right, where any of the supplement policy providers have to offer you a plan, and they can't underwrite you or they can't charge you more than they normally would, or they can't use pre-existing conditions to also charge you more. But when you're outside of this open enrollment period, that's when the insurance companies can sometimes refuse to offer you a policy, or they can charge you more than they normally would. So that's where be very careful if you were interested in switching to a different plan, because sometimes they can actually charge you more, or sometimes they might not actually offer you a different plan.
But,
Sure.
if you want to get the Medicare gap one, you should do it before Medicare's December 7th or whatever it changes.
So if you did want to start with a brand new with a plan, you can actually sign up at any time. You're not necessarily tied to the open enrollment period, but that's where if you're not already with a plan, or if you're outside of that open enrollment period specifically for the Medigap plan, that's where you would have to apply with the insurance company, and then that's where they could underwrite you, or they sometimes they can deny you a plan. There is only one company that would they would always sell you a plan, or they offer those. It's Blue Cross, right? But then that's where they will sell you a plan, but they can still underwrite you, or they can still charge you more.
And once you have that plan, is there a waiting period before you can use it?
For some, yes. So for some of the plans, they do have waiting periods of when they'll cover pre-existing conditions. Some don't, so just keep an eye out for those, or if you did want to find out which ones don't, or which ones do have those waiting periods. So we have lists of those Medicare gap policies, so we can show you which ones do. Because I can't remember for certain, but I don't think the Blue Cross ones do have a waiting period. Right? Okay.
They're very high.
Yes, they can be very expensive, yeah. And then, but if you currently have a Medigap policy or a supplement policy, as long as you're paying the monthly premium, they can't cancel your policy. They can raise the rates on you from year to year, depending on if you have higher medical costs. Because for most plans, they usually charge you or increase your premiums based on your age. And for most people, they use a 5-year scale, where when you're 65, you have one monthly premium, and then not until you're 70. If your health costs stay pretty consistent, it won't be until you're 70 when they might adjust your price. But if you do have pretty frequent hospitalizations or just higher medical costs, sometimes they can still increase your price during those middle years. So I kind of went over this already, but essentially, when you're first eligible for Medicare Part B, that's when you're allowed this 6-month period to enroll in any supplement policy that you'd like. So that's where they can't deny you, they can't charge you more than they normally would. They always have flat rates when you're just starting out with Medicare. And then again, there's no waiting periods for any pre-existing conditions when you're in this open enrollment period. And then after that 6-month period, they can actually charge you more or decide not to sell you a policy. And then one of the most popular supplement policies was that Plan F, because essentially that plan covered everything that Medicare didn't cover, so things like the deductibles, co-payments. But if you're eligible for Medicare after January 1st of 2020, those plans are no longer offered to you. There are similar plans. One of the closest is the Plan G. The only difference with this plan is it doesn't cover that Medicare Part B premium. But that's the one it's about $200, so it's not too big of a difference, because usually these G plans will cost less compared to those Plan Fs. But just keep in mind that the Plan G that's one of the more popular ones now, because it's very similar to that Plan F. And then I also wanted to mention there is another benefit or another program that I work with that helps with educating Medicare beneficiaries on Medicare fraud, because it's a very serious issue with Medicare, because every year over $60 billion is lost to Medicare fraud, and that's your tax money, that's everyone's tax dollars, where a lot of those commercials that you see, or the phone calls that you get, where those could be fraudulent, or they could be offering services that are being billed to Medicare that you don't actually receive, or sometimes they just bill Medicare for twice for certain things, or they bill for things that you didn't even receive. So that quickly adds up, and it's a very serious issue with Medicare. And one of the things you can do is just being aware that this is such a serious issue that can help a lot. But another thing is, so there are Medicare summary notices that you should receive every 3 months or so. If you don't get one, you can actually request that from Medicare. But definitely make sure you review those just to make sure that you are being billed for the correct services that you receive, or that you're not being billed twice. And another thing that's helpful is if you're able to log all of your doctor's visits or any services that you receive, whether it's in a calendar or in a journal, that way you can always cross-reference or look back to make sure that you are being billed correctly. No, definitely, jump in.
Is it true that if you go to 2 doctors in one day, one of them doesn't get paid?
I guess it depends. If it's for the same service,
No.
I could see that maybe being an issue, but otherwise, depending on why you go to see the doctor, if it's for a different reason, if it's really more of a billing issue, if they billed it correctly, or if they billed Medicare correctly, that shouldn't be an issue. Because I'm not sure how that would come up where they would refuse to pay for a service that you actually need. Yeah. Mm-hmm. So that's why I just definitely, if anyone is calling you to offer you services, Medicare usually or never calls you. They usually deal with the mail. Social Security will never call you. So if there ever is someone that's reaching out to you and then they do get to the point where they're asking for your Medicare number, or if they're asking for your Social Security number, be very careful with those. I would just say definitely just don't give them that information. If there is something that you do need, or if they do offer you something that you're interested in, always go with your doctor. If it's a piece of equipment, or if it's a test, or some type of procedure that you're interested in, it would be your doctor that would actually know how to bill this to Medicare, or if it was a service that is covered by Medicare, they would actually know, or your doctor would actually know whether it is something that you can actually receive. And if you do find anything that you think is either a Medicare fraud, or that could be a billing error, I would say first reach out to the provider or the doctor that is either trying to charge you twice, or just maybe made an error, because usually they can fix it pretty quickly. But if it was something more serious, if it is something that is actually fraud or abuse, you can call us, and then we can investigate, we can try to correct that issue for you. And then this is the number for the Senior Medicare Patrol. I did also have some numbers here. I'll make sure to give these slides, so that way you don't necessarily have to write these numbers down. But if you ever have questions about Medicare, it's 1-800-MEDICARE. You can call directly into them. You might want to try with us, especially if you took one of our brochures, because usually for a lot of things, Medicare might just refer you to a local senior health insurance program. So that would be someone like myself, or one of the local offices. So I would say you might want to try us first, but if it is something more serious, or if you want to start with Medicare anyway, 1-800-MEDICARE is their phone number. The Medicare website has a lot of information. It's actually gotten a lot better in the last year, where they have videos that can explain the different parts of Medicare. So you'll find just a lot of information on the Medicare website if you were looking to learn more about how your coverage works. Also, I have the number for Social Security, and also this number for elder care. This is what can help you find other local providers for various services that are available to older adults. So that's also a good number to keep. Then just more phone numbers that I have. So the Illinois Department on Aging, they actually provide a lot of our funding for the various services. So this is a good number to keep in case you did need to reach someone on the state level. And then again, the senior health insurance program, it's a state program, but usually they do refer you to local offices. So that's why I say if you might save yourself a little time if you just go ahead and call us, since we are a certified SHIP site. But these SHIP programs, it is statewide, so even if you live in a different county or in a different area, there's over 300 sites that offer these SHIP counselors. And so what we do as SHIP counselors, we provide unbiased information. We'll never tell you which plan to choose, or we could tell you what plan would save you the most money, but we wouldn't necessarily say this plan is better than the other, because that could be very different. We don't work for insurance companies, or they don't pay us for anything. So just keep that in mind. If you do want more of an unbiased resource, a SHIP counselor would always be best. There are insurance brokers if you did want to reach someone directly from the insurance company, but just keep in mind that they may have an incentive to steer you towards a specific health insurance plan. So just know they usually have some, they may be being paid or offered fees to steer you towards a specific plan, whereas a SHIP counselor, we wouldn't do that. And then, so this is our number. There was also in the first slide, but so we do cover a pretty large area. So not only Will County, we cover DuPage County, Grundy County, Kane, Kankakee, Kendall, Lake County, and McHenry. So we cover it's a large area, but we do partner with various agencies in these counties. So usually, like say, because I'm the main SHIP counselor for our site, so in case you're not able to reach me, we can connect you with a local resource that usually they have much more staff. And then these are just more numbers from other offices, whether you're in Cook County. But there are offices like this, area agencies. These are also statewide. There's a total of 13, but we cover one of the larger areas in Illinois. And then I do have the numbers for Will County. So the first one, for the Catholic Charities of Joliet, they're actually, they've been around for a while, but they just recently expanded into Will County this month. So they are the primary office that will be able to offer SHIP counselors, but also some of those other services that are available through us, like the transportation or the caregiver assistance programs. So I would say definitely keep that one first. Senior Services of Will County, that was the more established Senior Services office in Will County. They are still operating, so they also have SHIP counselors, or they are SHIP sites, so they can still be a resource for you if you'd like, if you're familiar with them, or if you still want to stay with them as far as getting assistance with Medicare. Two of the other SHIP sites is the Disability Resource Center and the Senior Assistance Center at St. Paul the Apostle Church. So these are all of the SHIP sites in Will County, so they would all be able to offer similar services as myself. And I'll leave these numbers up, and so I can take any questions if you have any questions about anything I presented, or even just in general. Yeah, just feel free. Oh, you're welcome. And if you didn't want to ask now, or if you just had something maybe more sensitive, or just if you wanted to talk one-on-one, definitely just take one of our brochures and keep my number. We can always set an appointment, or just feel free to call in, and I can always help out with any questions. Okay. All right. Okay. All right. Well, thank you for having me. Okay.
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.